You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to look years younger without surgery. With us, we have the Desert's esthetician, Marissa Rivera. Marissa, welcome to the program.
Thank you.
I should say welcome back.
Yes.
We've had you on the program before. Now, for people that don't know you, I guess you work inside of the Cosmetic Surgery Institute. What's your role there?
I'm actually the lead esthetician. I've been there for about 8 years. Work day to day just doing aesthetic treatments, and it's great. I love my job.
And you're, I mean, you're booked.
Yes.
And like, you know, at the beginning of the show, I said the Desert's esthetician, but people know you there.
I finally have, kind of developed a name for myself, so it's great. I do. You have to kind of call ahead to get in to see myself and all the other estheticians as well. So. Okay, good.
Now you work with Dr. Mo Zachary.
Yes.
Right, and you've been part of a team. So who's the typical person now that is going to get and seeing an esthetician?
There really isn't a typical patient that comes in. I mean, it can range from a teenager to someone my age in their 30s to a woman I have that's 85 years old.
Okay.
So there really isn't a typical.
So let's start with what's hot.
Okay,
right now.
The hot thing right now is micro-rolling. This is a new treatment we have, and if you truly want your skin to look beautiful and healthy and glowing, you'll want to do this treatment.
So what type of skin problems would you want to do this with?
You know, hyperpigmentation, lines, wrinkles, acne. Even if your skin is feeling kind of dull and tired, I hear that a lot. Women look in the mirror and they go, I just don't have a glow. This is the treatment that will truly bring that glow out in your skin.
So what is it?
It's a little tool that we use that creates almost like these little micro channels in the skin. So what it does is it draws in product. Anything that we're using, whether we pair it, we do an oxygen facial, it plumps the skin just instantly. And then all that product that you're using at home is going to work like 80% better.
So 80% better meaning what?
When it draws in those products 80% more than what you're already doing, you're going to just have this like plump, hydrated skin. And it truly does that.
How long have you been doing it?
Well, we just started doing it about a month or so ago, and it's the hot treatment. And what I love about it is we can combine it with all the other treatments that we're already doing.
Like what's a typical combination of treatments you're doing?
You know, the typical treatment, you could come in for the dermaplaning, which is by far the best thing that I think, offer there. It's a unique treatment, instant results. Women and men love it. Takes off that dead skin cell buildup. And really brightens the skin, and instantly, again, the skin has glow. So that's perfect for kind of a tired, dull skin. So dermaplaning, maybe a little light peel. We also do oxygen infusion therapy, which uses an ingredient called hyaluronic acid. It's like a drink of water for the skin. And living in the desert, you know, everybody needs that.
Now, all of the estheticians there, how many are there?
There's 3 of us.
There's 3. So you all share the same philosophy?
We do.
And you're all using the same techniques?
Yes, and I think what makes us unique, we kind of talked about it earlier, we are all truly passionate about what we do. We really do. We all love what we do, and we want to make people feel good about themselves. I mean, that's just the bottom line, is I want people to feel like, God, my skin looks really healthy, and, you know, I feel pretty, and I look younger.
Yeah. You know, we talked about, I said, do you see transformations? That means you fix their skin.
Yes. I hear that all the time. In fact, yesterday I had a client said, my skin has never felt as good as it has after just 4 treatments during season being with me. I also have another client, every time after her treatment, she looks in the same mirror, every time and goes, oh, thank you. And I'm not joking, and we laugh about it every time, but it does. You see them come in, their skin's kind of dull, you know, it doesn't have, you know, a pretty glow to it. And
do you get excited, by the way?
Yeah.
About this? I mean, when you get great results?
Oh yeah, because you know you're touching them and you're making them feel good, and you know it's all about, I think, you know, it's all about making them feel better about themselves.
Do you see changes in behavior? Like when you first meet them?
Oh, for sure.
You start working on their skin, they come in, maybe they're a little happier.
Sure. I mean, they might be dating, you know, or they might be...
Because they tell you their life stories, right?
Oh yeah.
Like
you're
hairstylists.
Kind of a therapist.
Same kind of a thing, right?
Yes, you're a therapist. But it's true.
I mean, look, when you look at someone 30, 40, 50, good skin, that's very sexy. Yeah. There's no doubt about that.
Yeah.
It's a standout.
Yeah, it does. And I think, and I hear it a lot. They go, I just want to have the glow like you have. And I have no problem saying, I'll get you there.
I know your age. I mean, you look really young.
Thanks.
And you work at a surgery center.
Yes.
It's nice to see that you don't look odd or overdone or anything like that.
No, and that's what I like too, is all of the treatments that I offer, I do on myself. You know, so I can.
And everybody's skin. Look, I've had you on the show before.
Yeah.
And when you guys all came in the studio, everybody looks a little bit younger.
Yeah.
Peggy, especially, too, the RN.
Yes.
So do you work on her, or do what?
We all kind of work on each other. You know,
Okay.
I mean, we work as a team. So we get Botox, or they'll come in and get facials, whatever it is. We all work together and.
Now this micro rolling, you call it, okay? It causes a bit of an inflammation.
It does.
So it'll fill in lines.
Yes.
And bags into the eyes and things like that.
Yeah.
We talked on the phone. That's the only reason I know. But somebody's going out for a party on the weekend. Friday, Saturday, an event. Good time to get this done?
Sure. Yeah. Now you could combine it with a peel. And if you do that, you're actually going to have a little peel in the skin, so you may not want to go to that party, the next night. But if you don't do it with that, oh my gosh, your skin looks amazing. And again, I have another client, did it, came home, her husband, who never says anything, said, honey, what did you do? So that just shows you right there. If your husband notices, then, you're like, oh, he notices something's a little bit different. So,
do you get recognized, by the way? Because you've been on my show for quite some time.
I do, yeah, I do.
They say?
Sometimes just say, oh yeah, you were on that show talking about about skin and how to take care of your skin. So it's, it's nice.
In the desert, because my assumption is, because people look great in the desert.
Yeah.
Would you say 50, 60, 80% of the women go to estheticians now?
Yeah, I think it's getting more popular, especially with men too. I have more men clients.
Men are coming in?
Yeah.
Real men?
Real men.
Is that well, good?
Yeah, I mean, there are more men that are doing treatments because they, in fact, a friend of a client that comes into me, they just got married. He's about 10 years older than her. He says, well, I have to start doing my facials now because I want to look younger.
Okay.
And he does, now his skin he feels better, and he's on a simple home care.
Could you take away 3 to 5 years, in your opinion?
I think so.
To the appearance of the skin?
I think so. And you can tell someone who takes care of their skin, and you can tell someone, who doesn't. And so it's never, to me, it's never too early to start, and it's never too late to start. Truly.
I mean, CSI. You guys call it CSI, right?
CSI.
Cosmetic Surgery Institute. You're known for the natural results.
Yes.
Okay, so they must ask you, what do you think about fillers?
Oh, yes.
And what do you think about, am I ready for a facelift, right?
Yes.
They ask you all the questions.
All the time. And it usually starts with the esthetician. So they kind of come in, I'm not really ready yet to go into maybe doing lasers or fillers. They want to just start, on getting their skin to look healthier. But then from there, we can, and that's what I love about where we are, because it's kind of a one-stop shop. You can now maybe start treating with a laser, and it doesn't have to be real aggressive, but start doing that. And
as estheticians, you say that you're doing things there that people they've never even heard of.
I hear it often with dermaplaning. They'll say, I've asked, do you offer dermaplaning? And they have no idea what they're talking about. So that, I think the oxygen infusion therapy, that's kind of known as Madonna's facial.
Okay.
And that's great before a party, an event.
Is there an art to this?
I think so.
To being an esthetician?
Oh, yeah.
Because secretly, I think I asked you on the phone, do you think you're like one of the best? Or the best? You said, I do, Randy.
I know. Well, I mean,
Is it because,
I do.
you know how to, push the technology?
Well, I think, it comes with building, the confidence. I've been doing it for 10 years now, so I'm a lot more confident than I was 10 years ago. I have access to just the newest of new things, and I love what I do. I mean, that's just plain and simple. I come to work every day loving what I do, and I think that's what makes...
Your skin is world class. I know your age. Okay, so do you do this stuff on you, this roller technique, this micro-rolling?
I did it actually a week ago.
And you noticed the big difference?
Yes, and my husband said the same thing. What did you do? Your skin looks smooth.
Interesting. Do you get complimented on your skin?
Yes.
Do people, really, routinely?
Yeah, people just look, oh, what do you do for your skin? I love your skin. What do you do? And I always just say, please come and see me.
Okay. Do your clients that go in to see you,
Uh-huh.
do they come back with stories of, I can't believe it, everybody asking me about my skin?
They
do. You hear that?
Oh yeah, all the time. All the time. Because again, what we do is so unique. We have so many different treatments. We customize it for you. You don't have to come, you can come in and just kind of tell me this is what bothers me, and then I sort of come up with a plan for you.
Now, you know, we talked on a pre-production meeting, and I know you have somewhat, and you didn't call it this, but like secret protocols. You don't want to give it all away on my show.
I don't like to give it all away.
Right? It's what separates you guys, why you get better results.
I think so.
And I need to go in there, you say.
You do,
and you think I'll look younger if I...
Yeah, I mean, and for men, you know, it could be every 3 months. You don't, you know, sometimes men kind of shy away going, I can't do every month. But I have a lot of husband and wives that come in, you know, together, and they love it. And it's relaxing. It's good for your soul, you know? It's like getting a massage. Just to lay down an hour out of your day and relax.
In this economy, why spend the extra money on an esthetician?
I think in this economy, especially if you're going on job interviews or, you know, whatever you might be doing, you compare two people, maybe one that has beautiful, glowing, you know, hydrated skin, and then to someone whose skin looks kind of dull, maybe wrinkled. You're going to present better to that, you know, to that interviewer.
And dating, people that are dating?
Dating, and yeah, whatever, or
divorced,
if you're getting
recently?
married, whatever, you know, I think it just boosts your confidence, and it feels good when someone looks at you and says, I love your skin. That makes you feel great, you know.
All right, well, Marissa, always a pleasure to have you on the show. I want to thank you for coming on.
Thank you.
And so if they want to make an appointment, they call the office. They can ask for you, but even though you're all doing the same technology.
Yes, we all do.
Approach.
We all work together as a team, so.
All right, good.
Yeah.
Thanks.
Thank
We'll be right
you.
back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that have acne scars. With us, we have dermographic specialist Vanessa. Vanessa, welcome to the program.
Thank you.
Now, for people that don't know, you work with Dr. Mo Zachary, the plastic surgeon, I guess, that everybody knows.
Yes.
In the desert.
Yes.
And I've had you on the show before.
Yes.
And so you do a lot of things there.
Yeah, I do. I'm a makeup artist, so I do everything from makeup lessons to brides, photo shoots. I'm a lash expert. I do the eyelash extensions.
You do the eyelashes there.
Yes.
All right.
I also am a permanent makeup artist specialist. I've been doing permanent makeup for 10 years, and I do a lot of corrective things with that as well.
Okay.
And I'm really excited about a new treatment that I've started doing this past year.
CIT. I know that's what you wanted to talk about today.
Yes.
And you said one of the things it's used for is acne scars.
Yes. CIT stands for Collagen Induction Therapy. Now, we're not actually putting anything into your skin. We're stimulating something that your skin already makes, which is collagen. It also stimulates rejuvenation of the skin. And what we do is we basically, I use a tattoo machine.
Okay.
And
But you're not putting any tattoo in there.
there's no pigment in the tattoo machine.
So this is somebody we're talking about somebody with acne scars.
Yeah.
Okay, so you go into the area.
Yeah. We're remodeling the skin. We're actually causing a dermal damage. It's controlled and adjustable, but what it does is it breaks up scar tissue without damaging the surface, because it's just a puncturing that's happening.
And they fill in.
And over time, the natural thing that your skin does is it makes collagen to repair that area that was damaged. And in the process, you get smoother, tighter, more even-toned skin.
Are you seeing good results?
Amazing results. Amazing results. One of the greatest things about this treatment that I think makes it really a good option is that the surface of the skin is not compromised at all. Your surface skin remains intact. If anything, it thickens the surface of the skin. So we're able to remodel the skin without having to take away anything on the surface. So this is great.
Is it painful?
No, it's not actually. You'd think it would be, but it isn't. We use a numbing cream, and most people say it's a very comfortable procedure.
One of the nice things that I just realized, I've interviewed your whole group today, okay, is that because you work in a plastic surgeon's office,
yes,
you have access to all the good stuff for numbing and things like that.
Right.
So much, I guess it makes it a lot easier.
Right, and this treatment can be used for any type of resurfacing. It can be used for sun damage. It can be used for large pores. It could be used to increase tightness in the skin. It's just a really rejuvenating thing. The skin actually loves it. It strengthens the skin.
What does Dr. Zachary think about this?
He loves it, and we actually piggyback this treatment with other treatments that he does. So he might do a laser and a facelift, and then wait a month, and then they get the CIT to just even get better results. So it can be piggybacked with other treatments, again, because it's It doesn't cause any damage to the surface of the skin. It's a really nice treatment. It can be repeated.
So the results are good. I'm going to meet one of your
Yeah.
patients that's
Yes.
had it done. She's very young. So is it young and old?
Yeah,
We're getting this done?
any age people can have this done. And basically any issue on your skin, if you want to see improvement in your skin texture, tone, and evenness, it's gonna
I've never heard
give
of
you
this
that.
before, and I've heard of everything.
It's a
I feel like
new
I have heard of everything. My friends are all dermatologists. I've never heard of this before.
it's a new treatment, and I really believe that you'll be seeing it more
But it
and more
works.
and more.
I mean, that's the main
It does
thing.
work. I say
Acne
on average,
scars, pock
50%.
marks.
50% improvement on the skin after one treatment is what I generally see.
Interesting.
Yeah.
So by creating a small injury to the skin, the body repairs itself.
Yeah.
Fills it in.
Right.
Interesting.
And the great thing, and one of the great points about this is, like, we live in California, and people are outdoors all the time. And you know, for some people, men included, I've got a lot of men clients that have this done for their scarring. It appeals to them because within a week they can go right outside, go hiking, go biking, not having to do anything more than what they normally would have done.
But they can go back to work the next day.
I probably wouldn't. No, you're going to have some downtime. You're going to have about 2 days of some redness on your skin. Redness, and then 2 days of some mild peeling, and then by day 5 you're looking good.
Eyelashes, because that's one of your specialties there at the office at CSI.
Yes, there's a lot of, some people might have had lashes done in the past and it was a good experience or it wasn't a good experience. It's a very detailed type of work. The lashes that I'm using are by Extreme Lashes.
So they're like permanent lashes in a way.
Basically,
you're weaving them in or something?
No, basically we use like a medical grade super glue. Like the kind that they use in the hospital to close.
Oh, so they'll last for how long?
They last as long as your
like
natural eyelash. About 2 months.
Forever?
About 2, not forever. Well, they're going to stay on with your lash. One lash is glued to one lash of your own. And so typical eyelash lasts for about a month to 2 months. So that lash is going to stay on until your natural lash grows off. And then what you're going to do is you're going to come back for little touch-ups on the lashes if you want to keep them on indefinitely.
Is that a popular procedure, by the way?
It's growing more and more and more popular. It really is nice to give people that ease in the morning that
people just don't know. You think it exists?
Well, I think that it's getting more and more popular, especially with the media, celebrities. They're wearing the lashes, and in my clientele in the desert, we've got a lot of retirement kind of people. They're very active though, and they don't want to fuss in the morning, but they want to look pretty. And so, I'll do this, and it just makes them feel like they can get up and ready a lot faster. I do like the permanent makeup and stuff, and it's just another thing that they can do that just makes their morning getting ready time shorter, and yet makes them feel really good.
You're part of the team. I mean, when somebody goes in with acne scars, Dr. Zachary is going to take a look. It may be a combination of a lot of different things, but you are now part of that team.
Yes.
With this new, what do you call it, CIT?
CIT, Collagen Induction Therapy.
Do you ever walk around the desert and see somebody with some, mild acne scarring, and you say, boy, they'd be perfect?
Yeah, I do, and I give them my business card.
You do?
Yes.
You walk up to people?
Well,
sometimes or every time? Or every time?
It kind of depends on the situation. I mean, you don't want to hurt anyone's feelings or anything, but, if maybe I could strike up a conversation with them and to the point where they ask me, what do you do? And then I can, at that point, say, I actually do this, and I can help you out.
Because you don't feel pushy talking about it because you think they're going to be better off.
Yeah, and the crazy thing is that this treatment is so unknown. Nobody knows it even exists. I mean, it's so brand new. And the way it was discovered was a plastic surgeon was sending his facelift clients to a permanent makeup artist to have a little pigment put into the scar. And what they noticed was that the scar was actually disappearing. And he thought,
because of the poking with a
needle.
needle.
Because of the puncturing of the tattoo machine. And so he said, let's look at this under a microscope and let's see what's actually happening here. And what they found was that collagen and elastin were coming in and repairing and smoothing and remodeling the area. So then they thought, well, let's try not using the pigment, and let's try it on wrinkles.
And
let's try it on acne scars. Let's try it on,
You love it? Is one of your favorite procedures?
Yeah, absolutely. And what I really love about it is I love how people are excited. They feel like this was a no big deal. It was not a lot of downtime. There was no pain involved, and I'm getting really good results with it.
I want to thank you for coming on the show.
Thank you.
Always a pleasure. You've been watching The Wellness Hour, the leader in medical news and information. For now, I wish you good health.
My whole face was red, just covered with, it looked just like I was perpetually flushed. and I didn't want to go anywhere. So I went to the Cosmetic Surgery Institute, and I got a treatment done by Vanessa. It was the collagen induction, and it completely changed my skin. It made the redness completely go away. I barely have to wear any makeup at all, and it's completely just changed my self-confidence. Oh, my friends couldn't believe it. Some of my friends who I hadn't seen in a while, they saw me and they just said, "I can't believe how great you look. Like what did you get done? You look amazing." And they never would compliment my skin before, so it was a huge change. I would really recommend it to anyone who had the same kind of problem as me. I went to dermatologists and they told me there was nothing that they could do, and they gave me medicine that just made it worse, and this was the only thing that ever helped. The procedure, it doesn't hurt, it's not bad at all. You just are red for about a day or two, and then your skin looks amazing. It's definitely worth it.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's all about skin today, how to look great without surgery. And with us, we have an esthetician, Danielle, from the Cosmetic Surgery Institute in Palm Desert. Welcome to the program.
Thank you. Nice to be here.
Now, I've interviewed a lot of the people at the Cosmetic Surgery Institute, and I guess we've never had you on the show. So for people that don't know you, you've been there about a year, a little over a year.
A little over a year, yes.
What is your role? What do you do?
What is my role? Well, I have a couple. I'm a medical esthetician, so people come to see me for facial treatments, dermaplaning, and I also work on people post-laser. So I take care of their skin the week after they have a laser surgery, erbium, whatever it may be, and I talk to them and give them tips on how to take care of their new skin.
So let's start with your typical client. Who is it? Who's the typical client?
Our typical client is a female golfer. Okay, we see that a lot. And I'd like to see more brides, though, because a lot of people come to Palm Springs to get married.
All right.
It is the destination hotspot. And we have a lot of treatments that they can do.
Could you make an impact, though? Let's say somebody's watching this in a hotel. They're getting married a few days. Could
100%.
you make that big of a difference?
Oh, yeah.
Oh, really? Okay.
We have a treatment called oxygen infusion, and you can see a difference immediately. You'll really see results 24 hours.
Results defined as what? Like, what am I looking at?
Hydration, plumping of the fine lines. So it uses a hyperbaric pressure to push a serum into the skin. And the serum is hyaluronic acid, vitamins A, C, and E, green tea extract, and aloe vera. And so it's all very natural. And you see results immediately that day. But most of the brides that do come in 24 hours prior.
So this could be, the same could be said for an event. There's an event this weekend.
Absolutely.
You want to look great.
An event, red carpet, a reunion, a special date. You know, if you haven't seen a friend in 20 years or even 5 years, it's a great treatment.
Now, I know your age, and you look very young, by the way, so it's nice to see you walk your talk. But you've been an esthetician for 11 years. And you told me in our green room, you said, Randy, we're doing things at CSI, and I'm calling it CSI. It's Cosmetic Surgery Institute, working with Dr. Mo Zachary, the plastic surgeon. But you're doing things there that you weren't doing elsewhere.
That's right.
And you're getting better results, you say. And I'm skeptical sometimes. I was telling Peggy and some of the others and Marissa.
Well, I can say just from my own experience, since I've been working there and since we have access to all these great new treatments, my skin has never looked better, personally. But that's one thing I hear from patients as well, especially new patients. You know, people come in and they're tired. They look tired and just dull. Their complexion is dull. They have a lot of sun damage. And really, they want to even out the skin tone, and they want to get rid of the lines. Well, we can do that. You know, you come in for a series of treatments. We have chemical peels. We do micro-rolling, dermaplaning.
Tell me about this micro-rolling. You say that's hot right now. That's a big thing you're doing.
So with the micro-rolling, it's an instrument with tiny gauges, and it actually tricks your skin into thinking that it's wounded. So collagen is going to be produced.
It's like a roller.
Yeah, so the collagen will be stimulated. Another thing about the micro-rolling is the product absorption. Normally, if you were to put a product on your skin, a moisturizer, there's about a 4% absorption rate. When you micro-roll, you are creating the tiny, tiny little holes. The absorption rate jumps up to 85%. So you're not just leaving with serums on your face and grease. No, it's going to be absorbed into the skin. So it will go deeper into the epidermis. You know,
one of the things that Marissa, the other esthetician, said, she said, Randy, it doesn't matter who they see, but it's very common that the that the clients or the patients will say, this is different. And they've been going to estheticians for years.
Well, our facials are different.
Why is that?
We are different in the fact that we do a medical facial. You're going to see results when you leave. You know, you can go to a spa and you can have some lotions massaged into your face. That's all nice and you can relax. But I want to go somewhere where my skin can change. People come to see us because they're not happy with their skin. One of the big things I see and I hear is when someone gets up after their treatment, they'll say, wow, oh my gosh, it feels so smooth. I can't believe my skin feels like this and looks like this. And then when you come in for a series of treatments, you will see a difference.
Do you think they underestimate, that the average person underestimates what can be done with an esthetician, a medical esthetician?
I think so. I think so. Some people would do
you
their
could make somebody look 3 years, 5 years younger?
Absolutely. Absolutely,
We're
yes.
out of time. I want to thank you for coming on the show. But
Thank
as a recap, somebody watching this, maybe they haven't been to an esthetician in a year, or maybe they're seeing an esthetician and they're not happy or they're not getting the results they want. What do you say to them?
Come in to CSI
All right.
and just try us out. Come in and have the dermaplaning. Take pictures before your treatment and compare it to after. And this goes along with chemical peels, laser, everything. Take a picture of your skin, whether it be your face or your hand. A lot of people have sun damage on their hands, and that can really tell your age. So take a picture, and then in a month or 2 months, compare them. You'll see a difference yourself.
I want to thank you for coming on the program.
Thank you.
And,
It was
and
nice
we'll
to
have
meet
you back. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.